Hello, I'm Maria from the Drug Education Network, or DEN as we are also called. This short video is to provide a quick overview of a resource that has been developed to assist you in your work with pregnant women. By the end of this quick overview, you will have an understanding of what this resource is about and how it can provide some guidelines when having conversations with pregnant women about cannabis use. DEN has worked with the Department of Psychology at the University of Tasmania to identify research gaps around attitudes to drug and alcohol use in the Tasmanian community. We saw there was a gap in understanding around cannabis use during pregnancy, and so as a result, in 2018, Georgia Figg completed her master's thesis, Tasmanian Women's Attitudes Towards Cannabis Use During Pregnancy. Our intention was to translate this research into practice by developing a resource for nurses, midwives and alcohol and drug workers that can provide some guidelines and evidence-based information to share with pregnant women on the topic of cannabis use during pregnancy. I would like to acknowledge the work of Georgia Figg in undertaking this research, and also the women who took part in the research, which has provided us with more insight into what pregnant women need in terms of health information and support. I would also like to acknowledge the midwives who took the time to review and provide valuable feedback on this resource. The resource is divided into two parts. The first part is written for healthcare workers, and the second part is designed as a plain English handout to be shared with pregnant women and women planning a pregnancy. As you can see from the image shared on the screen, the resource covers key statistics, including an overview of usage and attitudes to cannabis use. A summary of health effects of cannabis use during pregnancy is described, and then a summary of Figg's research is covered. On the next page, we can see in the pie graphs a snapshot of the reasons reported for use. Based on these findings, Figg concluded that providing pregnant women with information about the potential risks of cannabis use during pregnancy may help to reduce their actual use, particularly for those with neutral attitudes regarding cannabis use during pregnancy. This points to the key reason that this resource was developed: to support health workers to address gaps in information and the common myths around cannabis and its effects. These guidelines are covered on page 3 and highlight the importance of establishing a respectful and non-judgmental relationship that provides a space for women to talk about their cannabis use and feel supported to explore the ways they would like to make change. The resource provides some guidelines for how to do this, using the 5 A's model: ask, assess, advise, assist, arrange. This model is described with some suggested questions that you can incorporate into a conversation or brief intervention. On page 5 is a list of lower risk guidelines which are sourced from the American Journal of Public Health. You will see they recommend no cannabis during pregnancy. However, in recognising that for some women, abstinence is not an identified goal, these guidelines are important for talking through as a harm reduction approach. As mentioned, the second part of the resource is a handout that can be provided during a consultation or conversation and is designed to respond to common questions and myths about cannabis. On page 2 is a summary of lower risk guidelines that have been written in plain English. Now that we have completed this quick overview of the Cannabis and Pregnancy resource, I hope that you have a clear idea of its purpose and feel confident in following the recommended 5 A's approach for having conversations with pregnant women, with the assistance of the Questions About Cannabis handout. If you are interested in attending a brief intervention training session to develop more skills and confidence in this area, please visit our website to view our training calendar, or email us at admin@den.org.au. We are currently offering a mix of online or face-to-face training sessions to suit the needs of our training participants. Thanks for watching.